Michael Scott Powers. My title is Administrator of Children's West Surgery Center located in Knoxville, Tennessee. Children's West is a joint venture between East Tennessee Children's Hospital and a physician group that was created just for this called LeConte Healthcare. Physicians buy shares into LeConte Healthcare and so they can be investor owner. It's a 50-50 joint venture LLC partnership. The company is just celebrated our 20th year anniversary. I've been with the company only for the last 10, but it's over 20 years old. And we've done to date close to 85,000 cases. We're multi-specialty, but by volume, ear, nose, and throat is our largest specialty, followed by urology, followed by ophthalmology, oral surgery. We do very little, but some ortho, a little bit of cosmetic and dental as well. Currently have been using HST for 7 months. We are fully utilizing the PM product as well as the case coordination product. We have not brought up the EMR product yet, module. Our first step with that is by the fourth quarter, we're going to start using electronic prescription and then slowly then begin to integrate staff. And then finally, you have to bring surgeons along to utilizing the EMR. However, we have a system where even though we're currently paper records at the end of the patient process after they've been discharged, then generally within 48 hours, then that completed chart is scanned into HST. So we still have an electronic repository and we can still use it as I call it a hybrid EMR system that we still have access electronically to all the patient records. We had a lot of what I call software silo. We had a product that they had started with 20 years ago that was a good solid product for the business office side. So it was the registration, the OR schedule, the actual billing was all combined within this product. The product was just straightforward, user-friendly, but wasn't extremely flexible. Secondly is it did not have robust reporting. And lastly is the company who owns it, they were moving towards other software applications and upgrades. And so all they were doing was just maintaining as it was. There were no upgrades to that system. So that was one. The other key pieces is as we began to develop and grow here, we went to online, our pre-admission medical questionnaire is online, so that's web-based. Of course, we have payment is also online and web-based. And then we had a separate system that was an online that we were paying for to be able to start text messaging our patients and families of either deductibles, arrival times, NPO instructions, all those kind of things. And so you're dealing with 4 or 5 different companies and trying to, as much as possible, integrate where that at least, if not bi-directional, at least unidirectional, you could take from the registration system and send that information at least maybe to the texting system or to the medical questionnaire system. So at least that's communicated and preloaded so you don't have a lot of staff hours going in and redoing things that already exist, especially from the patient demographic side. And so as you had all of these things out there, and we knew that there was not going to be any further upgrades to the product, then we strategically say, let's just start doing our homework. Let's see what's out there. Let's see which program we think will fit our needs the best, will help us achieve everything that we want to achieve, because it was a great improvement going from calling patients and over the phone, going through all of their medical questionnaire that would take multiple phone calls, had to find them at a time that they could be still and be quiet, where they could think about, all of their different medical history of their patient, which is mainly their children for us, and get all that completed and filled out. Now they can just go online, at their convenience at night, on the weekend, and then they can just finish it, complete it, and then we have it available. Same thing with text messages. Whenever we used to call everybody to try to give them, okay, show up tomorrow at 7 a.m. Well, you may or may not get them to answer. And most people on their phones are not going to answer a phone number they don't recognize, right? And a lot of them don't even have their voicemail set up. And so you have this uncertainty of, do they know? Do they not know? Are they going to show? Are they going to show up on time? And you have this multiple systems. And then on the backside, whenever, we want to find out how did we do and how's the patient doing post-operatively and doing that follow-up. You'd make phone calls. Most of the time they wouldn't answer. They're at work, they're busy. Maybe you leave a message, maybe or maybe not, they respond. So by moving everything, and then our patient satisfaction, this was our last thing we did, was a paper that we would give them on discharge, and they could take it home, fill it out, and it was already pre-addressed and pre-paid for, pre-postage, right? But our return rate was usually about 15 to 20%, which is small, plus you're paying for all that. Well, now we have it integrated that we're using a third party, but we got a copy link that we just put into now HST's case coordination text messaging system, where we have all their information. It's auto loaded. We can tell to auto send. It goes out, and in the first month, we had more returns than we had in the first week of doing it, we had more returns than we did the previous month as a total. So getting to where you're really utilizing all of this technology to streamline, to be more efficient, but also to be even more patient and family friendly as well. And so we chose HST because they had this complete package, and some of the competitors do, but we think it's packaged better. And then the other part that for me sold on HST is that HST was able to take all of my patients in my old database and all of my scanned documents in my old EMR database, and they were able to then transfer those over, migrate that information into HST. And so that was a big deal, where I get to the point that I don't have to forever have two systems that I have up and running. A, the comprehensiveness of the products and what you offer. B is I think that the system is pretty user-friendly. It's just sort of intuitive in a lot of ways to utilize it. And then C, it was very cost competitive. And then D, the last one for me, was being able to migrate my old data and not having to in perpetuity have to keep two systems and pay for two systems. Actually, it went extremely well. I think key is, number one, is prepping them on that we're going to have to do something in the future, because I believe that the software that we're utilizing is going there, that the company was going to sunset it because they wanted to really sell their new products. And so knowing that somewhere in the near future we're going to have to do this anyway, and then coordinating it with looking at the robust of it and the whole implementation process of it, and just doing our due diligence and homework, that eventually all of these separate costs will go away, even though it will have a different cost. And at the end of the day, you have a new system that's going to offer everybody so much more functionality for a lot, not a lot more than we're paying when you look at all of the different software and applications that we were independently paying. I mean, we haven't even gotten to the point of physicians in their offices being able to access data externally. I mean, we haven't even got to the conversation of any remote coming in, or them going on their phones to deal with prescription issues or whatever. I mean, all of these things are future things for us, but we just see the functionality as it carries us through the next several years, that you have the platform to get us wherever we want to go. It's definitely, you have to recognize that no system is perfect. And maybe the way that our workflow is may be different than other workflows. So that flexibility, and one of the things that I think was positive for us is we paid for a trainer to come on site our go live date for the first couple of days, and not only was able to say, oh, this isn't working and why, and able was a lot of times to fix things on site. I think it's really easy to maneuver. For me as an administrator, the regulatory reports that I have to do for the state quarterly is extremely easy. It's just night and day difference between the old system and this system. The reporting is more robust and easier to dive into. And I think just itself, the OR schedule, I mean, you can get down to 5-minute or less increments on how you do your times and your OR rooms and how you design it, and you can color code and you can do surgeon, and again, you can even do a lot of communication out to the surgeons. They can see their schedule, share their schedules, know what's happening, know their start times. And so I think that it's just just the features and functionality of it, again, is so much farther ahead than anything that we had experienced before. Doing a lot of pre-registration in the old system, we have been able to eliminate that. And another big thing is that we are also using your Clarity product, which is your insurance verification piece, and it automatically looks at the deductibles, amount owed, and pulls all that together. So it's in one sheet of paper. From a facility standpoint, we can always make that no surprise based on what we have act, as well as communicate. And then again, this can be emailed and or text and communicated, whereas before, again, you make a lot of phone calls, and before, you're going out to different websites to pull patient benefits, go out and pull the information, and then you were manually putting together the allowables to the procedures, to the deductible, to what really they owe on a date of service. And it was all, really for us, handwritten. And so now with the Clarity product, it's really changed our workflow that you can see we become extremely efficient and accurate in our day-to-day. And in fact, what shocked me was we were averaging about 8 minutes to register each patient in our old system. And within 2 weeks of using the new system, we'd actually cut that down to 6 minutes. And so even that registration process is smoother and quicker and easier. I think our initial goal was to do no harm, make the switch, get everybody comfortable, be able to utilize it to minimally replicate what we had, and then just build upon it. And so over the 7 months, that's really was our goal. And so we've achieved all our goals but 2 so far. The 2 we haven't, but we're in process, is going from simple admit to the case coordination for our medical screening, and then implementing the e-prescription. So those are our last 2 goals, but all the other ones we have achieved. In fact, even doing the patient satisfaction link achieved earlier than we anticipated. The only thing that I can attribute from an outcome standpoint is going to be employee satisfaction, more efficiency in the business office registration department. A lot of times if I transition something from an outside to the inside, there's not really a lot of cost savings, because when I added Clarity, that was an extra cost. So that was something I wasn't paying for that I had to add, but yet it was the best right thing to do. And then I will be able to eliminate the texting, which wasn't a huge cost. And then the simple admit will be a decent amount of money once we can get that up and implemented and fully running. So from a financial standpoint, I'm not saving money. I'm actually spending a little bit more money to use the HST product. But I'm okay with that because of what I'm getting, a lot more from the product.